Dr. Mascarenhas, can you explain the main risks people should be aware of when living with PV? Maybe talk a little bit about progression, but also cardiovascular events or things that could occur.
I would say there's maybe three things I think about in terms of risks to patients with polycythemia vera. One is what we just talked about, is the risk of feeling unwell and not participating in life, fully as one would, and that's an important risk. I think the other risk that we often think about that we address with aspirin, therapeutic phlebotomy, cytoreductive agents is thrombohemorrhagic risk. So that's the clotting risk. The clots could be arterial, heart attacks and strokes, venous, like in your legs or your lungs or your abdomen. And people can bleed too. So we often just focus on clotting, but sometimes patients' issues are on the opposite side. They can have very significant nosebleeds or gastrointestinal bleeds. So clotting and bleeding are very real risks that we intervene for to try to reduce those risks. And then there's the risk that's quite bothersome to patients and can be quite anxiety provoking and detrimental to mental health, which is that constant risk and fear of progression of disease. It's just living with this chronic disease and worrying from day to day, from visit to visit, from blood count to blood count. Is the disease progressing? Is it worse? Is it get evolving? Is the bone marrow progressing to myelofibrosis, more fibrotic, scarred bone marrow? Will my counts go lower? Will my spleen get bigger? Will my symptomatology get worse? Will I have more clots? Could I potentially even develop an acute myeloid leukemia, an AML, which can happen in a fraction of patients with these diseases? So I'm very sensitive to the fact that there are many risks and many concerns of PV patients. Some of them are day to day. How am I going to feel? Am I going to be able to get through the day? Am I going to be able to interact with my kids? Am I going to be able to meet deadlines at work? But some of them are where will I be and what will I be like in the next 3, 5, 10 years?
Thank you. And how are clinicians monitoring for disease progression? And what can patients do to help with some of that monitoring?
Well, I think reporting your symptoms, because disease progression could be symptom progression, symptom worsening. So reporting the symptoms is really important. Monitoring labs, so the CBC changes in the white count, the hemoglobin, the platelet count, looking at the smear. Are there more immature cells in the smear? Or is there what's called leukoerythroblastic blood picture, where you see immature cells which shouldn't be there? Examining the patient, make sure the liver and spleen is not getting bigger. Those are the classic ways of monitoring for disease progression. As I said before, I'm not an advocate for just doing repeat bone marrow biopsies, but if something is changing clinically and symptomatically with the patient, that might prompt a discussion to repeat a bone marrow biopsy to evaluate, is there change in progression in the bone marrow?
Excellent. No, thank you. Are there any lifestyle habits or preventative measures that can help patients reduce these risks of clots or just, live a healthy life to help with their MPN?
Definitely. The obvious ones are the least sexy. It's the ones that moms have been telling kids forever, eat a well-balanced meal. And people say, well, what kind of meal? I think probably most data would suggest Mediterranean diet is probably the healthiest diet. Things like don't smoke, stay fit. Weight gain can contribute to risk of thrombosis, as well as people who move just do better. I fundamentally believe that. I think more today than I did even 20 years ago. People who stay in motion just simply do better. And if you don't feel well, it's hard to stay in motion. So, all of these things are intertwined. But not neglecting that people are not just their diagnosis of PV. So, for example, uncontrolled hypertension, hypercholesterolemia, other competing issues like kidney disease, heart disease, liver disease, all of those things have to be addressed because they all relate to and interrelate with the risks that are associated with PV. So, it's easy for me to say, and actually, as I get older and have to become a patient myself, I recognize it's harder to do, but staying compliant with your follow-up, with your medications, your aspirin, it's very easy to start dropping things off and saying, well, I don't know what this is doing for me, but I would really beg patients to really think about the implications of, not following treatment plans. Or if you have questions about treatment plans, engaging the physician to make sure you understand why you're getting that phlebotomy or why you're taking the hydroxyurea or the interferon. Why is the aspirin necessary? How many times a day should I be taking aspirin? So really engaging with those questions, I think, is important because the more informed the patient is, the more likely that they will stay compliant and happy with the treatment plan.